Nigeria's new health minister, Professor Ali Pate, has unveiled what he described as a 4-point agenda that would drive his vision for the health of Africa's most populous country and the biggest economy. The new 4-point agenda is focused on quality of governance and leadership of hospitals, regulatory capacity of agencies under the ministry, improvement of population health, medical industrialization, as well as investment in public health. Now let's dig for more on all of this with the Honorable Minister of Health and Social Services himself, Professor Ali Pate. Congratulations on your ministerial appointment, and we thank you, Professor, for coming in this conversation tonight on our Rice Exchange. Good evening.
Good evening, and thank you very much for having me.
It's great to have you on the show tonight. Thank you. Now, what's the key vision behind your 4-point agenda for Nigeria's health sector?
Well, the vision is that of our president, President Bola Ahmed Tinubu, to transform this country and this economy to be vibrant, that has engaged population that is healthy and productive, that is also prosperous and shares in the overall prosperity of our country. Health is at the center of the effort to build our human capital. And for us in the health sector, what we've outlined is derived from that vision of the president, to ensure that we save lives, we reduce pain, both physical and financial hardship from the cost of ill health, and that we produce health for Nigerians by preventing diseases that can be prevented and also reducing the burden of things like non-communicable diseases that are becoming to be a major issue in our population. A healthy population will harness the potential of our youthful population. We're young as a nation. At the same time, we're also aging. So both sides of the demographic picture, in fact, requires good health to be productive, to contribute in the economic development of our country and to actualize the prosperity that this country can actually enjoy in the period ahead. And to do that with everyone carried along so that the inequality that exists where the haves and have-nots is reduced to a minimum, including everyone, the poorest, the rural, women, the disabled, to be part of that journey in this country's effort to be healthier as a population. And the elements that you mentioned are the core of the ways that we intend to translate that vision of the president by improving governance, bringing in the state governments, local governments, the private sector, including the media, to be on that journey of a new consensus around the importance of health to Nigeria's human capital, to ensure that we include everyone, that we execute, we talk less and deliver, we have good information, and that we have strong regulatory entities that are not predatory on the private sector, but protect the lives and well-being of our population. And to ensure that population health outcomes is also improved. Basic things, immunization, maternal and child health, that no woman should die from pregnancy-related complications, from hemorrhage or other causes. Preventable diseases like malaria, like tuberculosis, that can be identified and treated to improve the health outcomes. Deal with non-communicable diseases through our primary healthcare system and have better quality hospitals at the primary level, at the secondary level, at the tertiary level, and even need be even at the quaternary level, the 4th level that at this moment doesn't exist in our country. And to unlock the value chain. You are talking about the positive things, and I think there's a lot to celebrate, and what we can see going forward is that there's a whole value chain around health that we can unleash, so that health is not just a consumption sector, it's also a productive sector. It can contribute to the growth of our GDP, can create jobs by medical industrialization, by producing commodities, generic pharmaceuticals, biologicals, medical equipment, services, IT, that can contribute to our economic growth. And that potential has not been harnessed very well. And finally, to protect the gains that we're making by protecting public health against public health threats, outbreaks, whether it's Lassa fever, cholera, or as we had seen many years ago, Ebola, or even COVID most recently, which can undermine our economic security and our national security. So strengthen the public health capacity through entities like Center for Disease Control, Port Health, will in effect reduce communicable disease and the threat they pose, and we encourage investors to feel comfortable that we're a country that takes care of our public health and is linked to the regional security and the global security. So those are the elements for translating this grand vision of our president in his renewed hope agenda to transform our economy into a country that is vibrant, is productive, and that it has its people at the center of that development.
Well, Honorable Minister, Professor Pate, when you as a health minister start talking about investment, money and economy, that's music to my ears. That's quite unusual to see how you're trying to bring health sector into investment and economy. And that sounds like something like a whole departure, seeing the role that health, that it says wealth, plays in Nigeria's economic drive. But again, now you talk about your 4-plan agenda. How do you plan to drive this in order to achieve success that will take the country's health industry and the well-being of the people to a higher level, different from what we've seen in the past? Tell me a little bit about that.
Yes, so two prongs. I think on the governance side and how we run our hospitals, that has to be in the context of our federation, states, local government, and the federal government. We will set direction, activate leaders at all levels. Our CMDs of the federal teaching hospitals have to be activated in a way that the quality of service has been delivered, the infrastructural investment that will be made will transform how our people experience the health system. And working with the state governments, the primary healthcare as the foundation of our national health system has to function with the community health workers and other health professionals working together to deliver the basic services and the higher level services as appropriate for our population. Expanding health insurance through the National Health Insurance Authority with a new law that has been passed. That is a very important piece of that. Now, to drive the economic development agenda, as you said, is new. It requires a cross-ministerial approach, which the president really is engaged in that, because it requires not only the Ministry of Health, but the Ministry of Industry, Trade and Investment. It requires our regulators, NAFDAC. It also requires other entities like the Standard Organizations of Nigeria. It requires the Sovereign Investment Authority, as well as for the federal government, the Ministry of Finance Limited, to work together, as well as the private sector. The Manufacturers Association of Nigeria has a pharmaceutical group, and other actors in the private sector to do a few things. One is to improve the policy environment so that it's conducive, that we can harness the demand in our sector, but also the fiscal policy so that tariffs and other measures can be put in place to improve the environment for our domestic manufacturers. Acknowledging that there are several other things that have to do with the business environment that are outside the control of the Ministry of Health or Ministry of Trade, is in terms of our overall power, labor, and other things. So that's one aspect. We can also work on the regulatory side to improve the capability of NAFDAC to ensure that commodities that are being imported into this country through various channels are minimized, reduced, and that the distribution of those commodities is curtailed, such that our own industries will have a chance to produce and compete favorably rather than being undermined by actors that may flood the market with really unwanted products. Yes. That regulatory capacity is so key to medical industrialization. And finally, the financing, the type of financing that will be needed. It's not only sort of just private loans, but there may be other forms of financing, equity financing, and some de-risking of the capital that will be coming through. And we would work with the entities that are in government, and as well as development financiers, to see how that can be put in place so that there will be a type of capital that will be facilitating this industrialization effort for our local manufacturers, but also external investors who want to come and manufacture in our country. It doesn't mean that overnight we'll produce all that we need, but that if we can have investors and manufacturers who can come and produce, even if it's fill and finish of their products, they are welcome to do that because they will employ our youth, they'll employ our technologists, technicians, yes, and they'll produce things on our soil that can serve the needs of our people. So by doing that in a coherent way, in a cross-ministerial way, we believe that we can unleash the potential that exists in the sector. And on the services side, I think the private sector accounts for a large chunk of health provision in our country. And for those who are traveling abroad for medical tourism, whether they go to England or India or other parts of the world, oftentimes they don't go to public facilities. They go to private facilities. So if we can make the environment conducive, what will prevent those dollars or euros or pound sterlings be used at home, create jobs here. But that will require a conducive policy, which President Bola Ahmed Tinubu is committed to producing so that we can have a prosperous country overall and that we can be on the world stage as a country that is very proud of its own health system.
Honourable Minister, you touched on a very important point in the comment you just finished about the role of agencies such as the ministry, such as NAFDAC and others. And of course, you know that since the pandemic, international institutions, the Gavi Alliance, the African Union, Afrexim Bank, and others locally have been looking to see how we can produce more of drugs, vaccines, and others locally. So how much attention would you be paying into our research centers, the laboratories, and try to see that we can have our local indigenous healthcare institutions to be part of this entire process, perhaps involve the universities and others in doing what you can call boots on the ground, local research to ensure that we produce those medicines locally that will be more affordable and easy for Nigerians and that are made just for us because of our climate and everything else.
So I think first of all, there is no country that has the population that we have, more than 200 million people, that doesn't produce the majority of its own consumables and generic pharmaceuticals. We're largely dependent on products from outside, even though we're a large population. So effectively, we're just a market for other people. So to change that will take time. I'm not saying it's going to happen in a year or two, but at least we should be on that path, whereby we're producing increasingly more of our commodities that we'll consume in our health sector. Now, the various entities that you've mentioned obviously have an interest in supporting our economy to grow, and it's part of the regional security and global security agenda. But at the root of it, we have to be involved in providing some of those solutions. We have excellent researchers and health professionals in our country, some like Professor Christian Happy, for instance, that are world-class, and there are many researchers of that nature. We would work with our colleagues in the Ministry of Education, with Tertiary Education Trust Fund, for instance, to invest in facilitating the research activities of our own researchers and protecting their intellectual property and hopefully creating path for them to commercialize some of what they are producing that will benefit us as a country, but potentially benefit other countries as well. So that we're not just consumers of other people's products. I think the era where we're entirely dependent on solutions crafted elsewhere to come to our aid, I think we should begin to see when that era will gradually ease out. I'm not saying that overnight we will be almost autonomous and independent, no, but as a constructive member of the global community, that Nigeria is not isolated by itself, but is contributing the heft that it has of the intellectual capital of Nigerians here, but also amazing Nigerians all over the world who are doing research in many parts of the world, and to try to bring that home. There are some that I can tell you, for instance, Simon Agwale is an example, who has worked with NIH, is a world-renowned vaccinologist, and has been trying to establish a plant here in his state of origin. Those kinds of actors are there, but we have to harness them. And we have to provide some of the public resources, but also harness some of the external resources, like those that you've mentioned, to see how we can facilitate that and begin to commercialize some of what they are producing in terms of new knowledge and provide the environment that they can thrive and be successful over the long run.
Interesting. One major problem that we've had many years is about fake and adulterated drugs, both imported and those locally manufactured. How will you deal with this?
Well, I think it's still work in progress. I think our National Agency for Food and Drug Administration and Control, NAFDAC, is a regulator that, if you look at the continent of Africa, is among the 3 to 4 top national regulatory agencies. It has reached maturity level 3, according to the World Health Organization global benchmarking sort of framework. And obviously, it has to continue to build on that momentum to get to level 4. It's a lot of work for that. So while we've done much to achieve level 3 in terms of regulating, licensing, imports, there are parts of the effort that go beyond NAFDAC. In our ports, it's not only NAFDAC. I think that's where we need the customs, NDLEA, and the Pharmaceutical Council, who are regulators of the sector, to also up their game, so that what is coming into our country will be as much as possible within the standards that we expect them to be. Secondly, the distribution of those commodities. NAFDAC itself has to do more. And we spent time with the Director General of the NAFDAC to emphasize the need for us to invest in their ability to improve on the regulation of the distribution channels through the warehouses that will be created, but through the capabilities that are necessary. Thirdly, there is a need for a laboratory domestically that also is able to do bioequivalency studies. At the moment, we have chemical equivalency capabilities, but that's not enough. We need to also be sure that the standard is kept up, because if we produce for our population, what we produce should be to the standard that is safe, that is effective, so that our industries can be able to rub shoulders with any in the world, and we have the potential to be able to do that. But a strong regulator is needed, and the industry should see that effort to improve regulation in its own interest, because a weak regulator will just be a recipe for deindustrialization. Because if there's not a strong regulator as strong as we want it to be, folks can bring in counterfeit and substandard medications and undercut our domestic manufacturers, and we don't want that to happen. And with colleagues in Ministry of Finance, we will work to see what are the fiscal policy measures, the tariff regime that will be put in place to reduce, in a way, the prevalence of, let's say, counterfeit products or products that we can produce ourselves. It's not necessarily protectionism, but it's really crafting policy in a way that allows the domestic industry to also participate, whether it's in generic medicines or over time, or there are even specialized medicines or even phytomedicines that can be produced here for our market, but also for others in the region and potentially globally.
Interesting conversation with you, Honorable Minister of Health. But again, just to sum it up, a primary healthcare system in Nigeria that is affordable to every Nigerian on the street, in the manner of speaking, is that possible? What will make it possible, and how soon do you think that will be possible?
It is possible, but it requires leadership, which we are fortunate to have a president who really cares about this and wants to work with state governors and other local governments to ensure that we get that to that point. I think the National Health Act, which was signed into law in 2014, provided for a mechanism, a basic healthcare provision fund, which provides 1% of the Federation account towards basic healthcare services. I have to say, that fund has not been optimally deployed yet. And we would work towards unlocking that source of fund to align what federal government is putting behind in the primary healthcare arena with what states ought to step up and do, so that we guarantee basic healthcare at the quality that is needed for our populations. Because many of our folks in this country, in the rural areas, things like immunization, they don't have access to them enough. So we have diphtheria, we have measles outbreaks, we have mothers dying from childbirth, we have frontline health workers that are underfunded, undertrained. And to resolve that, we in the federal government will stand up, we will lead with direction, and will provide the resources that the federal government has apportioned. But that's only part of the story. The states need to step up, and we'll work with them in a collaborative manner so that we put what is necessary to ensure our primary healthcare system is functional, that the infrastructure meets minimum standards as much as possible, is equipped and is trained. And let me say one other thing. We're embarking on an effort to try to retrain the tens of thousands of frontline health workers so that they're able to have the intellectual capability and the readiness to deliver the services that our population needs and in fact deserves. I think the President expects that from us, and my colleague, Minister Dr. Tunji Alausa, the Minister of State, and myself, as well as the staff of the Federal Ministry of Health and our parastatals, will need to orient ourselves. We've been activated and will be delivering on that, but we need the partnership of the subnational level of government, as well as the private sector and our external development partners. not only in terms of the traditional things, but things like malaria, for instance. We have the Global Fund, we have the US President's Malaria Initiative, and other external actors to align behind this direction that our government is taking to respond to the needs of our population.
We thank you very much, Nigeria's Honorable Minister of Health and Social Welfare. We thank you for your time and wish you and your team all the best. Have a great evening, Professor Ali Pate. Thank you so much.